Welcome to today's SUD Learning Community Echo, Substance Use Disorder Through a Pharmacy Lens. Today we'll be hearing from Amelia Arnold on standing orders. My name is Bethany with CCSME, and I'll be supporting today's webinar. Just a few quick notes before we begin. First, neither the presenter nor the planners have any relevant financial relationships to disclose. This activity has been approved by the Maine Board of Pharmacy for 1 hour of continuing education credit. This activity has been planned and implemented in accordance with accreditation requirements and policies of the ACCME through a joint providership of the Hanley Center for Health Leadership and Education and CCSME. The Hanley Center is accredited by the MMA Committee on Continuing Medical Education and Accreditation to provide CME for physicians. The Hanley Center has designated this activity for 1 AMA PRA Category 1 credit. Recording and live stream transmission of this webinar without consent is not permitted. And now I'd like to introduce our presenter. Amelia Arnold is the Vice President of Operations for Community Pharmacies. She is a licensed pharmacist employed by community pharmacies and the legislative liaison for the Maine Pharmacy Association. The MPA is a state pharmacy organization that addresses the advocacy, continuing education, and professional needs of all licensed pharmacists, pharmacy technicians, and student pharmacists in Maine. Their mission is to promote public health by advocating for the profession of pharmacy. And with that, I will hand it off to Amelia for our presentation. Thank you all for being here today.
Hey everyone, I really appreciate you joining me during your lunch hour. I'll add one thing to that bio, thank you, Bethany, is that I also teach pharmacy law at the University of New England. So I see a few familiar names in the crowd. So thank you for joining today. And with that, I'm going to get going with the presentation. Today, we're going to be covering standing orders. And really, I would say I broaden it a little to how you can access naloxone really through pharmacy channels in Maine. So with that, today our learning objective is to identify existing standing orders on local, state, and federal level and ideas and policy solutions being explored. And I have nothing to disclose for conflicts of interest. So I think by this time in your pharmacy lens echo, but naloxone can be administered intramuscularly, intravenously, subcutaneously, and intranasally. And it is currently one of our best options for opioid reversal, opioid overdose reversal, and it is available in Maine by prescription, collaborative drug therapy management agreement, pharmacist prescribing, standing order, and it is available over the counter. So today I'm not going to dive into just that typical prescription relationship that you would have where a patient sees a practitioner and they send a prescription to the pharmacy, because I think we're all familiar with that avenue. We're going to talk about the other options that are referenced in law and really try to dive into the state of like the ecosystem here in Maine of how to obtain naloxone and maybe where there are still some gaps to care. So if you look at the Maine laws and rules, Maine law and the Maine Pharmacy Act allows pharmacists prescribing of naloxone, and it does come with certain training requirements, and those requirements are to be set forth in rules. So if we look at the rules were written in 2018, and they are Chapter 40 of the Maine Board of Pharmacy Rules packet. So really what it says kind of is the introduction in there is that it says these rules establish the procedures and standards by which a pharmacist may dispense naloxone hydrochloride under a prescription order, standing order, or collaborative drug therapy management agreement and may prescribe and dispense naloxone hydrochloride to a person of any age without there being a prescription drug order, standing drug order, or collaborative drug therapy management agreement. So in the rules, they say they're going to dive into how naloxone is dispensed by prescription and also standing order and collaborative drug therapy agreement, but really the rules basically just exclusively focus on pharmacists prescribing and dispensing. So we'll cover, again, all of those avenues today and talk about where there may be some shortcomings still for access. So for collaborative drug therapy management agreement, this is the one here that maybe is the most complicated of those options. So collaborative drug therapy management agreement is an agreement between a practitioner and a pharmacist. So that practitioner may be a doctor of medicine, they may be a nurse practitioner, and it has to have a treatment protocol. So the agreement and the protocol must be submitted to both the Board of Pharmacy and the other licensing board, whether that's the Board of Medicine or the Board of Nursing, in order to be eligible to have an agreement. A pharmacist must first take 15 hours of continuing education in the practice area to initially qualify, and then they may only perform monitoring for the first 3 months. And then after that, they can prescribe using the practitioner's credentials. And they also have to take 5 hours of continuing education related to that topic annually. So there are much more extensive rules and requirements outlined in Maine Board of Pharmacy laws and rules, but I just wanted to give you that this is an option. This would be typically you might see in like a primary care setting that you would have a patient meeting with a pharmacist, and then the pharmacist would then prescribe naloxone to them, and you would still go and get that prescription at the pharmacy. So again, there's a lot of barriers to entry here in order to have this option for patients. With pharmacist prescribing, this was first passed in 2015, and it wasn't passed, I guess I would say, quite right with language that the Board of Pharmacy felt that it authorized pharmacists just to continue to dispense and not prescribe and dispense. So the legislature passed an update in 2017 in order to make that kind of fix. And then the Board of Pharmacy had to make rules, and those were put in 2018. So at the time in 2015 to 2018, this kept being referred to as making naloxone over the counter. And I have that in quotations because we know as pharmacists, it really did not make it over the counter. It did not remove that prescription. It just allowed pharmacists to prescribe and dispense it. And I think that's really kind of what the disconnect was of 2015, that the language wasn't quite there, is that everyone just thought it would make it that the pharmacists could give it over the counter, but it still was in fact a prescription item. We know that because at the time, the FDA had it as a legend drug. So that was something you heard all the time of making it over the counter, but that's not really what happened then. In order to prescribe, the pharmacist had to take a 2-hour continuing education class that met the requirements in order to prescribe and dispense it. I will say one barrier that did not come about is that the Board of Pharmacy did not require pharmacists to apply for another license. So it's not uncommon that when we get a new authority under our license, we have to apply. So examples of that might be to administer drugs and immunizations, you have to apply to get your immunization license. In order to prescribe birth control, you will have to apply to prescribe birth control and get another license. And then same with your collaborative drug therapy. They did not make that for naloxone, so they called it really an honor system. So what it should have looked like is that pharmacists took the 2-hour CE, and then they could then begin prescribing and dispensing. But a pharmacist had to produce the information about the CE if requested. So I have pharmacists, including myself, who took that CE back then, and now they're like, wait, can I still do this? And they're looking through to make sure they still took the right CE or that they have the information. But I would say it's much better than requiring the license at that time. And one other really important note I would say is that you had to prescribe and dispense it. So if you were meeting with a patient in like your your ambulatory care practice, you couldn't prescribe it and give them a prescription to take to the pharmacy. It had to be in that one transaction of you talking to someone, you prescribing it, and then them leaving with the prescription for the naloxone. So it was a prescribe and dispense situation. For the rules that they made, they had an extensive list who was eligible for pharmacist prescribing. And so without going over each and every one of these, I just want to highlight, they said eligible patients include, but are not limited to. So really they opened it up that anyone could prescribe and dispense it, or be eligible to receive that prescription for prescribing and dispensing, which I think is great. Again, they list a very extensive list of who they think potentially could have benefited, and I would agree with all of it. But also, I know at least in one of the transactions one of my pharmacists had, it was a Good Samaritan that came in and said, I've been hearing about this. I'd really like to have naloxone in case I ever encounter it. Can you please make a prescription for me? And so it was very broad language that you could do that. It didn't have to be just that you or a family member were at risk for overdose. Which brings us to standing orders, which I think is a really great step forward for access. And there's still a few kind of gaps, though, that we'll cover. And that's really the piece of this conversation I want to make sure that you take away leaving. So the definition of a standing order, according to Merriam-Webster Dictionary, is an instruction of prescribed procedure enforced permanently or until changed or canceled, especially any of the rules for guidance and government of a paramilitary procedure which endure parliamentary procedure which endure through. So in healthcare, what that looks like is it's a mechanism by which a healthcare provider can write a prescription that covers a large group of people. So they don't have to have that interaction with that specific patient on that specific day that results in a prescription. What it looks like is they can write a prescription that would cover a large group of people. I think it's important to note that standing orders can be specific to certain patient populations and not all encompassing. So you could have a provider's office write a standing order or a provider write a standing order for all of their patients. They don't have to say that it could be anyone for the standing order. It could be easier for universal coverage when you're looking at standing orders when they're utilizing an inpatient stay, because that standing orders specifications may be that any patient at this hospital or any patient in this health system is eligible to receive that naloxone. But for outpatient and retail pharmacies, what I've found through the years is that when someone asks for naloxone or when you identify someone who needs naloxone, it almost stops you in your track and you're like, okay, what's the next step and how do I get this product for them? Because each pharmacy or each pharmacy chain may have differing standing orders. So, for instance, a large multinational chain may have a standing order that covers every location in the state, or a small independent may not have a standing order on file. So, I would say that's a downfall of this, is that it does greatly expand coverage, but it's not necessarily universal. So, for instance, we in the state of Maine have a standing order for Maine Care. And the Maine Department of Health and Human Services, of which Maine Care falls under, issued a standing order for prescribing naloxone nasal spray products. It was issued by Dr. Isaac Benowitz, and he's the chief medical officer and the state epidemiologist. You can find the standing order. I have it linked on the slide, but also it can be found online under the Maine Department of Health and Human Services, Office of Maine Care Services, Provider Resources, and Pharmacy Services. So I know it's a little small on the slide, so I'm going to break this down for you. So under the authorization section, it states that DHHS is authorized to issue standing orders for non-prescription drugs. This standing order authorizes licensed pharmacists to create a prescription for and dispense OTC nasal spray products for naloxone, and it allows for you to get a naloxone nasal spray in 2 units. I'd highlight here, though, that the eligibility for this is Maine Care members only, although it is Maine Care members of any age. So this covers a good portion of our state, but not everyone in our state. And it took effect immediately upon the authorization, and it shall remain in force and effect for the duration of 1 year, at which time the order may be renewed. So it was first issued, from what I could tell, that it was in September 8th of 2023, although the current signature date is of May 12th, 2024, when I looked at it earlier this week. So we are coming due for another renewal. But again, this can't be, and it's a small detail, but it's an important one. It can only be used for the over-the-counter version of naloxone. And there's a patchwork, I would say, of standing orders in Maine around the state besides that. So just looking at my company, Community Pharmacies, I pulled some of our files on what we have for standing orders. And we have a couple locations that an area doctor just sent out a standing order, sort of unsolicited, and said, I want anyone who wants naloxone to be able to get it. This standing order is in effect until I revoke it. You may use my name and just tell me within 7 days. We have other health systems, of course, that have standing orders that are able to use it for their patients. And I would say that there's another office that we have that said, yep, if any of our patients want it. So it's important to note that the eligibility detail is important in a standing order. And many are blanket in that you may use it for anyone. But of course, that may vary between pharmacies down the street from each other or different companies. And then the other thing to look at is the authorization. So that Maine Care standing order authorizes you to use Dr. Benowitz's information to dispense OTC naloxone. Other standing orders may allow you to do the RX version of the nasal spray or perhaps even the injectable, and they don't have that limitation of just using either OTC or the nasal spray product. And I think that also is worth noting here that what needs to be in a standing order is not defined in Maine pharmacy law or Maine pharmacy rule. So I don't think that's really an obstacle. I just bring that to your attention of that there is some leeway there on what you would be able to include or not include in your standing order. So that brings us to over-the-counter, which I've mentioned a few times, and I think it's great to have over-the-counter Narcan available. I also think probably most or all of you on this call know that this was not the magic fix that everyone hoped it would be. So it's been available since March of 2023. And remember, Main Care ordered that standing order in September. So it was a pretty quick turnaround time in order to be able to dispense it to Main Care patients by a prescription. Now, if it's not dispensed by a prescription, if it's just dispensed by someone walking up to the pharmacy counter, when I research it, I really find that you might be able to find it in the $35 range, but more commonly, it's usually like $45 to $50 for the 2-pack. So that is certainly not an insignificant cost for many people, which can be overcome if they have prescription insurance that it may be available with either a copay or for nothing. But again, that's not insignificant. The access issue, I think, is also very large because if you walk around the state, most of these products are going to probably be found behind the counter at the pharmacy counter. And it is not a behind-the-counter product. It is not equivalent to something like pseudoephedrine. It is an over-the-counter product. And talking to my peers and colleagues, I find that there are many reasons for that. It may have to do with like the supplier availability. It may have to do with concerns of theft. It may be that it's in line of the pharmacy view. It may not be in line of the pharmacy view. Pharmacists may or may not know where it is. So it's certainly not a magic fix. Narcan over the counter would be great for those patients who maybe don't want that interaction with a pharmacist. But it doesn't fix everything where it comes to availability. And I will just add that over-the-counter products are allowed in vending machines. So that's something that's being discussed more and more. But I would caution you that the legislature several years ago passed a law that said an vending machine that contained over-the-counter products must be licensed with the Board of Pharmacy. And I think that's important to note because for the most part, the Board of Pharmacy in Maine does not license anything to do with over-the-counter products. So there is no law or rule out there at the Board of Pharmacy that says you have to stock Narcan, and if you don't, over-the-counter, and if you don't, you could be cited on an inspection. That's not something at this point anyway, that I believe that they are involved in with licensing of over-the-counter products, except when it comes to vending machines, there are very specific rules that have to be met for that vending machine, which means the vending machine must be licensed with the Board of Pharmacy. So with that in mind, coming to kind of the close of the didactic lecture here, I just want to highlight some of the gaps here and pros and cons, but also gaps we have, because it sounds like if you're talking about this, there is a million ways to get Narcan, right? It sounds really, really promising, but each one I would say has its advantages, and we've certainly come a long way from when it was only available, from a prescription from a practitioner. But we are not to the point that I would say like universally everyone who needs it has access to it, unfortunately. So the first is CDTM, the Collaborative Drug Therapy Management. So a pro of that would allow pharmacists to use practitioner prescriptive authority to write the prescriptions. But the con is that there's very significant training to initiate and maintain, and there's going to be limited patients who may see that pharmacist daily. So it's a very small population of patients who may be there, and a lot of obstacles in order to offer that. For pharmacists prescribing, the pros would be there's increased access for patients without a practitioner relationship, and you can use the prescription insurance coverage, which is great because it will be available either for a copay or for no cost potentially. But the con, I think, is really significant here is you have to find a pharmacist who took the training, you have to visit the pharmacy, and you have to have that time for the screening and prescription processing. And I'm not aware of a way to pull the information on what pharmacist took the training because we didn't have to apply. So I think potentially at the same pharmacy, one day you may be able to access this and the next day you may not for that prescription product. For standing orders, I think we can agree it's been a really great increased access for patients without a practitioner relationship, and there's no need for a patient-specific RX. Or even if they do have a practitioner relationship, you often can use this, such as the Main Care order, in order to use it with your insurance coverage. So that's really great. A con might be that it's not written out that all patients can utilize it and may be limited to certain pharmacies and may be limited to certain patient populations with certain insurances or certain practitioners. And I would say the best way to describe it is there's a patchwork of standing orders that can lead to confusion. And so even, again, within my company, if someone says, I want to get this patient naloxone, we sort of have to go through this list and say, what's the most appropriate way to do that? And then for over the counter, I think we can all agree it certainly has increased accessibility. You can obtain it without it processing as a prescription, but the con is that it may still be behind the pharmacy counter and the cost may be prohibitive. And I think with the OTC version, it's also important to note that it is specially labeled. So if you have a prescription only version of the nasal spray behind the counter, you can't sell that over the counter. The FDA has special labeling that it's only the over the counter product, which again is probably a really important reason why we should all be carrying that to make sure that there is always that option available to patients.